Good morning, student. Hope Good morning, students. Hope all of you are fine. Welcome to today's ophthalmology class. Speaking, Dr. Nandan Kusum Das, Associate Professor, Department of Ophthalmology. Today, we are going to discuss about examination oriented, and this is the today's class is MCQ and SCQ. How will you prepare yourself MCQ preparation and SCQ preparation? Usually, under surgery paper 2, there are two subjects, ophthalmology and otolaryngology. In marks distribution in MCQ, in ophthalmology is 10 marks and otolaryngology another 10 marks. And for time distribution for 10 marks, 10 minutes, and for otolaryngology for 10 marks, 10 minutes. And first, this is the some pictures of this is as like question like surgery paper 2 MCQ question. And first you write your name, then code number, registration number, and you carefully write carefully read, write T for true and F for false. There is some patterns of MCQ. Just you this is the for preparations of MCQ. And before discussion, usually there is a MCQ, but all question will come from chapters of ophthalmology which are discussed previously in your lecture class, like anatomy and physiology of ophthalmology chapter, and some cosology, and eyelid, conjunctiva, cornea, chapter of cornea, lens, refractive error, glaucoma, uveal tract, and dacryocystitis, intraocular tumor, and ocular trauma. These are the chapters which very important for if you read properly, then your MCQ will be easy to you. Answers of MCQ easy to you. So there is a format of MCQ. Medial wall of orbit. This question usually comes from anatomy. So when there is this type of question, if true on left side you just true, on left side if false, left side on false. Not not true, not no. If true, not try to false. You first you read properly and try to understand what is the meaning and what is the actual answer. Then you write tree. Repeatedly F, never. Answer clearly write T, clearly write F. Okay. Now medial wall of orbit. Medial wall of orbit formed which are the bones? Frontal process of maxilla. Is it true? Of course true. Lacrimal bone, true, and part of the frontal bone. Usually part of the frontal bone not responsible for medial wall of orbit. So answer is false. And orbital plate of ethmoid vein. Right? This is the true answer. And body of the sphenoid bone. Also it is a true. Here only one answer is false and all answer is X and all answer is true. So this is the format of MCQ. Format of MCQ. And there is a this question from eyelid, chapters of eyelid, consists of 4 layers. Usually eyelid has 6 layers, but here 4 layers. The answer is false. Upper eyelid consists of 152 number of cilia. Upper eyelid, lower eyelid. This is the true answer. Meibomian glands more in upper eyelid. True or false? Usually meibomian more in upper eyelid. This is true. Chalazion is painful condition. You know, sty is painful condition. So answer is false. Orbicular is oculi supplied by third cranial nerve. You know, orbicular is oculi supplied by seventh cranial nerve. So answer is false. Just this is the there may be another question maybe in your exam like in eyelid sty related, there may be trichic acid related, there may be entropion related. So you read properly chapters of eyelid, and if you read properly chapters of eyelid, must you any types of MCQ answer MCQ you should answer properly. This is the format. This question not exactly in your exam, maybe there is a style related, maybe there is a internal hordolam, there may be external hordolam, tricare, etc. So you read properly chapters of eyelid. And this is a question from chapters of cornea. At first, for preparation of MCQ chapter of cornea, you read properly chapters of cornea. First, you read anatomy, some anatomy of cornea, some physiology of cornea, some pathological condition, classification of corneal ulcer, keratoplasty related, corneal ulcer treatment related. So you could read at first read properly. There is some questions from forms the anterior surface. Cornea forms anterior 1/6 of the outer fibrous coat of the eyeball. 1/6. This is the answer is true, and provides about 30% total power. Answer is true. Refractive index is 1.38. False answer. Cornea is vascular or avascular? Cornea is avascular. Bacterial corneal ulcer is more common in farmer. No, fungal corneal is common in farmer. This is the types of question and answer you thinking what about actual answer. And cornea, another question may be uh, cornea supplied by which nerve? You know, fifth cranial nerve. Some examiner may give cornea supplied by third cranial nerve, and this answer is false. And some examiner may give some question, cornea cornea maintains the structural integrity of the eyeball. Answer is true. So this is a type of question of MCQ of chapter of cornea. And people is another important topics of MCQ. You know what is the people, what is what are the causes of people, and there is some disease, what are the patterns of people. This is the preparation. How you preparation regarding the people. First, what is people, what are the causes of meiosis, what are the causes of mydriasis, and some disease condition, what about status of people. And there is a question, dilated pupil is seen in pontine hemorrhage. Usually, you know, pontine hemorrhage pupil is small constricted. So answer is false. So you should know what are the causes of. You should know what are the causes of other constriction of people. What are the other causes of meiosis of people. Tremulousness of iris is seen in aphakia. In chapters of aphakia, I discussed in my lecture class. Tremulous of iris is present in aphakia. So answer is true. People is pinpoint in close angle glaucoma. Again, I read, people is pinpoint in close angle glaucoma. You know, in close angle glaucoma, people is mid dilated. So answer is false. This is the then thinking chapters of another disease related to people. And white pupillary reflex is seen retinoblastoma, term is known as leukocoria. So you should know what are the other causes of leukocoria. And in that answer is true. And anisocoria is found in Horner syndrome. Horner syndrome, you know, there is some criteria. Horner syndrome, actually denervations of the cervical sympathetic nerve characterized by some features like mitosis, apparent anophthalmos, meiosis, and anisocoria. So in Horner syndrome, anisocoria is found. Answer is true. And chapters, this is a question from chapters of refractive error. In aphakia, Purkinje senson image first and seconds are absent. You know there is a 4 Purkinje senson image. 1 and 2 from by cornea, and 3 and 4 from by lens. So in aphakia, this question first and second are absent. Answer is true or false? Answer is false, because in aphakia only absence of lens, but cornea is present. So cornea is responsible for formations of first and second Purkinje sensory image. So there is some technical question in aphakia. Purkinje sensory is absent first and second. Answer is true. Total loss of accommodation you occurs in aphakia. So you should know what are the accommodation, what are the causes of total loss of accommodation. Here there is just one question, but you should know another causes of total loss of accommodation like atropine, like pseudophakia. So also in aphakia, but here answer is aphakia. Answer is true. Temporal crescent is typically present as myopia. In chapters of refractive error, especially in myopia, in pathological myopia, there is some features of some features present in fundus. One of the features is temporal crescent. So this answer is true. Divergence squint is a complication of hypermetropia. So many complications develop in myopia, like divergence squint, like complicated cataract, retinal detachment, osteostaphyloma, etc. But usually convergence squint found in hypermetropia. So answer is false. Biconcave lens used in hypermetropia. Biconcave. Usually, in case of there are the three important types of refractive error: myopia, hypermetropia, and astigmatism. Myopia, for correction of myopia, we will prescribe to patient concave lens. For hypermetropia, we prescribe convex lens, and for astigmatism, we will prescribe what type of lens? Cylindrical lens. So in hypermetropia, answer actually convex lens, but here concave lens. So answer is false. Thinking what are the actual scenery, then you understand what is answer is true or false. Lens at first, for preparation of chapter of for preparation of MCQ from chapter of lens, you read properly chapters on lens like anatomy, physiology of lens, then function of lens, and there is some pathological condition of lens, especially cataract. You properly read cataract. And question is, polypia is the symptom of cortical cataract. Polypia, of course, this is the true answer. Phacomatous glaucoma occurs in mature cataract. So you know when there is some complications of cataract develop, important complications in lens-induced glaucoma. The important lens-induced glaucoma are phacomorphic glaucoma and phacolytic glaucoma. Phacomorphic glaucoma occurs in immature cataract and phacolytic glaucoma occurs in mature cataract. So here right, phacomorphic glaucoma occurs in mature cataract. Answer is false. Usually phacolytic glaucoma occurs in mature cataract. Then another question, lens derives its nutrition from air. The answer is false. Rosette shaped cataract is a feature of traumatic cataract. This answer is true. And YAG laser is used in the treatment of after cataract. YAG laser, after cataract here, that means posterior capsular opacity. Any some patients of cataract surgery after 6 months or 1 year or even after 2 or 3 years, patient develop some opacification of posterior capsule. This is the late complications of cataract surgery. There is another particular name is after cataract. And if any patients develop PCO or after cataract, treatment is YAG laser capsulotomy. So after cataract, this is but there is some different name. Some student maybe not known about this. So after cataract, nothing. This is the posterior capsular opacity. So answer is YAG laser capsulotomy. So answer is true. When examiner gives some question in prof examine, there is some particular term change which is not. There is some examiner choice give some ethical term in answer script or question sheet. Glaucoma. This is the questions of glaucoma. Glaucoma is the in so many chapters in ophthalmology, so a very important topic is glaucoma. So you for preparations of glaucoma, you read repeatedly and you should properly glaucoma definition, glaucoma classification, and glaucoma some important primary of close angle glaucoma and angle closure glaucoma, primary open angle glaucoma, and some secondary glaucoma. And anti-glaucoma drug you read properly. From if you prepare yourself of chapter of glaucoma, this is MCQ is the nothing. This is very easy to understand what they actually which is true, which is false. Regarding ophthalmos, boys are first question is regarding ophthalmos. This is a congenital glaucoma. Boys are affected more than girls. So if anybody not attended in lecture class, it is impossible to understand what is the true or false. So you read properly, then your answer is very simple. So answer is true. Atropine is contraindicated in acute near angle glaucoma. This answer also true. Stony, stony. This is a spelling mistake. Stony hard eye is seen in primary open glaucoma. Usually, stony hard eye is seen in acute congestive near angle glaucoma. So answer is false. Shallow anterior chamber is found in narrow angle glaucoma. Answer is true. NVS, there is a the examiner chose some symbolic question. NVS, I think some students may be difficult, face difficult, will face difficult situation. What do you mean NVS? NVS is the neovascular glaucoma. So neovascular glaucoma seen in central retinal vein occlusion. This is the answer. You know, important causes of neovascular glaucoma is diabetic retinopathy and central retinal vein occlusion. So here one example is central retinal vein occlusion. So answer is true. And this is the questions of chapter of lacrimal apparatus. When you prepare about chapter of lacrimal apparatus, you properly read some anatomy of and physiology of lacrimal apparatus and some pathological condition like especially dacryocystitis, classify the dacryocystitis, acute, chronic, and acute and chronic. What are the treatment? And another important classification is congenital dacryocystitis. You properly read treatment option of congenital, treatment option of acute dacryocystitis, treatment option of chronic dacryocystitis. And some important, you should prepare yourself about some causes of epiphora and lacrimation. Very important. What is epiphora? What is lacrimation? So epiphora occurs in iritis. This answer is false. If important causes of epiphora are, you know, any obstruction from punctum to nasolacrimal duct, and there may be some causes are important punctum malposition and lacrimal pump failure. Here right iritis, so answer is false. Nasolacrimal ducts often seen nose the nose at the middle meatus. Then you everybody know nasolacrimal ducts in inferior meatus. So answer is false. Lacrimal abscess is the sequelae of chronic dacryocystitis. This answer is true. Lacrimal sacs located in lacrimal fossa. Then you know two important fossa for lacrimal gland and lacrimal fossa. There is a sometimes difficult to differentiate what is the location of lacrimal sac in which area and what is the location of lacrimal gland in which area. Actually, lacrimal gland situated in the fossa for lacrimal gland and lacrimal sac situated in the fossa. So answer is true. Choice of treatment of infantile dacryocystitis is DCR. The answer is false. Answer because there is a last option treatment of the infantile dacryocystitis is DCR. Usually when a child go to 5 or 6 years, then we will decide patients need to DCR. So usually not the ideal choice for infiltrate across the DCR. Answer is false. Then uveal tract. This is the some MCQ question from uveal tract. Typical coloboma of the iris is situated superiorly. There is a coloboma. You should know what is coloboma. Coloboma means some notching and gap of some intraocular structure. Coloboma may be present in iris, may be present in lens, may be present in eyelid. So may be present in choroid. So here typical coloboma of iris is situated in superiorly. Actually, there is a gap or notching of the iris situated superiorly. Answer is false. Typical coloboma or iris is situated inferiorly. So you should know about this. What is coloboma and what are the location of the coloboma in iris? What is location? Usually inferiorly, but here right superiorly. Answer superiorly. So answer is false. Rubiosis iridis is seen in diabetes. So you should know what is rubiosis iridis. What is rubiosis iridis? Rubiosis iridis is the neovasculation of the iris. Neovasculation of the iris and is the earliest stage of neovascular glaucoma. I repeat my answer. What is rubiosis iridis? This is the neovasculation of the iris and this is the earliest stage of the neovascular glaucoma. So this neovascular glaucoma usually we may find in diabetes. Am I? This answer is true because rubiosis is the early stage of neovascular glaucoma and neovascular glaucoma may be found in diabetic patients. So answer is true. Opticate optropine is the key drug of acute iridocyclitis. There is uh, some some controversy question. You know, in in iridocyclitis, there is a two important drug will prescribe. One is steroid and second is atropine. What is the main key of drug? Here, this is the inflammation. So, main key of drug is steroid. So, some student mistakenly give this is the true answer. So, actually, this is not a key drug. Steroid is the key drug. So, answer is false. Chronic use of topical steroids may lead to glaucoma. You know, there is some condition will use steroid chronic, like especially vernal keratoconjunctivitis of children. Usually, on that case, normal anti-allergic drug, histamine, antihistamine, or mast stabilizer, or combined anti-allergic drug, sometimes no beneficial to children with vernal keratoconjunctivitis. On that case, sometimes we choose steroid, but this steroid, if you use long time, resulting glaucoma. So this term specially name is steroid induced glaucoma. So question is, chronic use of topical steroids may lead to glaucoma. Answer is true. Maton fat KP is found in tuberculosis. What is KP? KP is keratitic precipitates, usually found in corneal endothelium, and it is usually seen with the help of slit lamp by microscope. So there are the different types of KP found in uveitic patient, like fine KP, like moderate size KP, large KP. Another name is fat KP, and usually found is this tuberculosis and sarcoidosis. So mutton fat KP is found in tuberculosis. Answer is true. And this is the questions from chapter of ocular trauma. Enucleation is indicated in panophthalmitis. You think about what is enucleation, what is evisceration, what is panophthalmitis, what is endophthalmitis. Panophthalmitis is usually infective condition, and endophthalmitis not always infective condition. Sometimes infective, sometimes non-infective. Usually, panophthalmitis is always infective condition. And what are the procedure of enucleation? We remove the whole eyeball, but we leaving behind the some meninges or part of the optic nerve. If during enucleation It is the in case of panophthalmitis, enucleation is indicated is panophthalmitis. Answer is infective condition. Answer is false. D-shaped pupil is seen in iridocyclitis. This is another ocular or traumatic condition of the eye. If there is some trauma on people, there is some uh, loosening of the iris, and people usually round shape. For loosening of the root of the iris, people shapes it D shape. So answer is true. KF rig is found in Boehmer's membrane of the cornea. KF means Kessler Fletcher ring. You know it is usually found in Wilson disease, and KF rig found in Boehmer's membrane, usually KF ring found in Decimen membrane of the cornea. So here Boehmer's membrane answer is false. Bossius ring is found in posterior surface of the lens. Bossius ring found in anterior surface of the lens. So answer is so you may mistake. Bossius ring found in posterior surface lens. If anybody not properly know answer, you will give me true. So you read properly. Bossius ring found in anterior surface lens. Answer is here false. Hyphema. When question arises hyphema, you know what about hyphema? You know hyphema is collection of blood in the anterior chamber. Here question is collection of pus in the anterior chamber. So if pus present, term is hypobion. Here hyphema. So answer is false. So this is the some question of MCQ. Hope everybody will beneficiated about how will you prepare yourself about some MCQ. Now this is the SEQ, how will you prepare. Again same things regarding preparation of MCQ SEQ. You should properly your lecture class, your topics properly, anatomy, physiology, and some disease condition. What about I and our Professor Moshe Thakur sir teachers teach to you thoroughly. You read your chapter, then MCQ and SEQ. It is easy to understand how will you prepare yourself. And there is a mark distribution is 35 in chapter of ophthalmology, and otology in otology another 35. Here mark distribution is 1 hour 20 minutes. Easily when we supply to some answer kit A group, B, C, D. You remember again. I remember A and B for ophthalmology, and answer kit C and D for otolaryngology. What about answer you at first C or D? What about it is your your headache. If you prepare, if you want first you answer C D, it is your choice. But you should remember never answers of otolaryngology in answer script A or B. A and B especially for ophthalmology. Some students mistake, and if you mistake answer right in your, especially in chapter ophthalmology, right in your C and D group, your marks will 0. Because C and D is during exam packet and seal, and when go to ENT examiner, then answer is A and B. They don't know, the respected otolaryngologists don't know about some the answers of ophthalmology. So even he will be mind what you what students write. So answer may be 0. So out of 35, will you give 0? There is no chance to pass in SEQ question. So in patterns of SEQ, especially in ophthalmology, group A and group B. Under group A, there is a 6 question, and among C, you should answer 5. And another group B, and in 6 question, among 6, you should answer 5 question. And another important things in group in each question there is a three subclass sub question like A, B, C, and mass distribution A for 1, B for 1, C for 1.5. Regarding uh, answer of SAQ question, when a teachers give to SAQ question, at first you read for 5 minutes properly what is the question, and you thinking how will you give better answer in your answer script. And first thinking you you thinking about 5 minutes what are the actual good answer for each question, then after 5 or 6 minutes then you will start the answer. Otherwise somebody we will observe some we observe some students uh, when receive some question start repeating start very fast, then they're unable to recapitulate some good questions answer. So I request to you, after receive question from teacher, you you evaluate the questions properly, you read repeatedly question, then after 5 or 6 minutes start the question. Okay, now there is a some format of questions. This is the first question is define external hordolam, internal hordolam, and these are chapters of these are questions of from eyelid. In eyelid you know so many important questions, you should prepare yourself like eyelid layers, eyelid function, and what is sty, what is chalazion, treatment of sty, treatment of chalazion, complications of chalazion, and difference between sty and chalazion, malignant tumors of the eyelid, and entropion, ectropion, trichiasis. I think you will read properly in your uh, from your lecture class. Your so your preparation will be enough. And second question is internal hordolam. There may be some queries some students. Internal hordolam means infected chalazion. Internal hordolam means infected chalazion. External hordolam means sty. And write down treatment of sty and treatment of internal is like same, but if separately you will write. And enumerate the and third question is enumerate the neurogenic and myogenic causes of ptosis. You know what is ptosis, what are the causes of ptosis. Ptosis may be neurogenic, ptosis may be myogenic, ptosis may be involutional, ptosis may be some mechanical. So here just mention neurogenic ptosis. You know neurogenic ptosis are causes of neurogenic ptosis are what is this? Third palsy and Horner syndrome. This is the so you specifically here question is specific, answer should be specific. So very little bit answer. So no anything extra things, avoid it. And second question, draw and level of lacrimal drainage system. You should when I was I given my word class, I advised to some students you draw some draw and level. You should practice like draw and level of cornea, draw and level of lacrimal apparatus, draw and level of eyelid, draw and level of retinal layer, eyeball cross section, eyeball cross section, and artificial intraocular lens. You practice. It is one among them one of the drawing level maybe you may face in your exam. And another question is in type of history and treatment. You know types of history: congenital, acquired. Acquired again acute and chronic. Treatment of congenital. What about you? What about you know? You should write properly. The one treatment option of congenital is hydrostatic masses and probing and intubation, and last one is DCR operation. And third question is write down complications of untreated chronic decholestasis. Untreated chronic decholestasis, you know what about that. Another things I like to say, there is some format, but another question you should prepare yourself like scenario related. Suppose question number two, examiner change the pattern of question. What about that? Suppose a lady of 35 years come to you with the complaints of watering and discharge in from right eye, watering and discharge. What is your diagnosis? Then your diagnosis is right-sided chronic decholestasis. This is the question, and how do you proceed, and what is the management, etc., etc. So this question may be changed as a scenario like, and this is the questions of Vision 2020. Maybe you collected from your lecture class, and write down vitamin A deficiency. Very very important. WHO regarding vitamin A, you should read properly. Like what are the function of vitamin A? What are the sources of vitamin A? And xerophthalma, classification of xerophthalma according to WHO, and what is keratomalacia, and what are the treatment options of vitamin A deficiency. You read properly. It is very important. Some very maximum examiner choice about this, even in Viva process. And follicle papilla. This is a question from conjunctiva. What is follicle? What is papilla? And causes you should read properly. And in conjunctiva, another some topics is important like neonatal conjunctivitis, like allergic conjunctivitis. Very important, very very important. You should read properly. Even pterygium, pseudopterygium, you read properly. And here another important question is layers of the retina. They just draw. Ocular complication of diabetes mellitus. Uh, Maybe discuss in my lecture class. I hope you'll collect it. And third question is four causes of vitreous hemorrhage. Vitreous hemorrhage. Usually, vitreous is transparent. Here found is vitreous, transparent vitreous gel. But if there is a hemorrhage, term is vitreous hemorrhage. Important causes of vitreous hemorrhage are, first you write down trauma. Then some retinal vascular disease like diabetic retinopathy, central retinal vein occlusion, branch retinal vein occlusion, some bleeding disorder. If any patients with bleeding disorder, like hemophilia, idiopathic thrombocytopenia, and there is some neoplastic condition like leukemia, aplastic anemia. There is a responsible for development of vitreous hemorrhage, and so should know about causes of vitreous hemorrhage. First, you of course write trauma. There is another important to you when a questions or examiner asks to you what are the causes of anything, like causes of visual loss of vision, causes of ptosis, causes of beta hemorrhage, you should write or say chronologically. Chronologically means according to severity, according to importance, you say first. So in this, what are the causes of beta hemorrhage? First you say trauma, then write etc etc. First you write trauma. Then question number 5, why is cornea is avascular transparent? Collected, this is chapters of cornea, enumerate function, cornea function, and hypopyon. Differential diagnosis of hypopyon. Differential diagnosis of hypopyon is pseudohypopyon and hyphema. And question number 6, define normal pressure glaucoma. This is chapter of glaucoma. And how do you diagnose it? How will you diagnose it? You remember visual field, very important. Fundoscopy, intraocular pressure, very very important. So how will you diagnose it? Then write LBC. And remnants of past attack of primary neurological glaucoma. Some students, there may be puzzles of some word, remnants of past attack. Past remnants means and past attack. This means what are the effects of after attack of primary neurological glaucoma? What are the effects of occurs after primary neurological glaucoma? Like 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 foldings of the deciment membrane of the cornea, iris pigmentation, and glaucoma flacan. Glaucoma. This is the important answer. And group B, another six number of question. Among six, you may choose any five question, and each question there is a three subclass. Here question is number A, focolite phacomorphic. You know about this, and write the mechanism action of acute attack of neurongulcoma. Of course you know, and outline the treatment of acute attack of neurongulcoma. Here question from glaucoma. So glaucoma is a very important chapter. Every examiner choice the chapters of glaucoma. So you read properly what is glaucoma, classify glaucoma, and there is an important glaucoma like neurongul glaucoma. What is neurongul glaucoma? What are the stages of neurongul glaucoma, and how to manage such a case of neurongul glaucoma? And scenario like question, like what about scenario? Like if a lady 40 years yesterday night developed headache, eye ache, and redness, and history of vomiting, and from today morning patients complain sharp decline of vision in right eye. Question is what is your diagnosis? Answer is acute neuroglaucoma. And why you say neuroglaucoma? Write some clinical feature. So you should properly some clinical features. So in neuroglaucoma there is a scenario like question. And scenario, if scenario, then your answer is acute neuroglaucoma. And from this there is another question may develop. They may arise some what are the other causes of redness, and what are the ocular emergency. You know what are the ocular emergency of eye, like acute neurogenic glaucoma, acute anterior uveitis, and corneal ulcer, and some traumatic condition, chemical burn, etc. There is some question arise. Even it is important in MCQ. And anti-glaucoma drug you read properly. Primary open angle glaucoma you read properly, and congenital glaucoma. Question number 8. Pain uveitis. You know about this when whole uveal tract involved. Causes also know, and drug use to treat such a case. Use here any uveitis. Your treatment is steroid and mydriatis. Then according to cause. Answer. First you say according to underline the according to cause. Pain uveitis maybe causes tuberculosis, maybe causes sarcoidosis. So treatment is this. And question number complicated cataract. This is a chapters of complicated cataract. You know about cataract properly. Cataract types, classification, risk factor, surgery related, and some steps of SICA. Everything you should know. Here, question already right here. Risk factors of cataract formation. You know there is an important risk factor and steps of SICS. Question number 10. Pseudophakia and aphakia. Pseudophakia. What is pseudophakia? When cataractous lens replaced by artificial intraocular lens. What is aphakia? Absence of lens. And optical changes in aphakia. What are the changes occurs in aphakia? Like maybe I discussed in my lecture class. So what are the important changes occurs in aphakia? I think everybody know. Just repeat the answer. I try to repeat the answer. What about that? Accommodation, total accommodation is lost. Optical power is lost, and there is a reduce the astigmatism. And this is the important optical change occurs in aphakia. And draw level of artificial intraocular lens also should prepare. Artificial intraocular lens, haptic part, optic part, and optic for vision. And question number 11, what are the intraocular tumor? Intraocular tumor. When a question arises intraocular tumor, just you write in children retinoblastoma, in adult choroidal melanoma. Simply. And differential diagnosis of leukopenia, at first you write retinoblastoma, and then course disease, then congenital pattern, then etc. So whatever you know. While you manage a case of dangerous one. So differential diagnosis mentioned here retinoblastoma, congenital glaucoma, caused disease. Among them, which is dangerous? Retinoblastoma. Why dangerous? This is a malignant condition. If you treat properly, not properly, it may go to brain. Ultimately, patient die. But in case of caused disease, in case of congenital, patient not chance to die. So in this is the dangerous condition. Dangerous cause is retinoblastoma. And now hyphema and microhyphema. Microhyphema, I think this is the new to you. Hyphema, this is the collection of blood in anterior chamber. Microhyphema, this is the only red blood cell present in the anterior chamber, and it is usually seen in microscope. This is the micro. This is the only red blood cell present in anterior chamber of the eye, and it is usually seen by microscope. This is the microhyphema. And there is a scenario-like question: a girl of 14 years of old inflicted with a blunt trauma over her right eye, inhumate sequelae. This is the answer: sequelae of blunt trauma. Eyelid, what happened? Conjunctiva, what happened? Anterior chamber, what happened? Lens, what happened? Retina, what happened? Optic nerve, what happened? And last question is steps of removal of SCFB. SCFB is superficial corneal body. What are the steps of superficial corneal body? You know that first, permission from patients and local anesthetic agent fit the universal eye scapulum. First, try to remove the corneal fluidity by jet of fluid. If not removed, then we go for special improvement like foreign body spurt or hypodermic needle. After that, remove by hypodermic needle, antibiotic ointment, and pet bandage for 24 hours. I think so. SCQ and MCQ question is easy when you prepare yourself from your lecture class, and then if you read properly lecture note, I think MCQ and SCQ is very easy to you. I hope some understand what are the patterns of SCQ, what are the patterns of MCQ, and up to now today, thank you to all.